This is Crystal Fenn with MedPage Today. Statins have been gaining ground in primary prevention use, even getting FDA approval in one case, but it's time to put on the brakes according to a new Cochrane review. Dr. Daniel Simon of University Hospital's Case Medical Center offered perspective on these conclusions.
There's a significant reduction in heart events, death, heart attack, stroke, and the need for angioplasty or bypass, but an uncertain effect from a cost-effectiveness standpoint or quality of life. So my take on the study is that we need more information. You know, cost-effectiveness is a tough thing both for doctors and patients to really get their hands around. And as we move now from what we call proprietary statin medications, meaning that they're not generic, to generic statins, the whole cost-effectiveness ratio changes. So as you know, Lipitor or atorvastatin will be coming off patent very soon. So not only do we have simvastatin off patent as well as lovastatin, but very soon we'll have the #1 selling statin medication, Lipitor, as generic. Well, when these drugs go from $3 to $4 a day to only $4 a month, it completely changes cost-effectiveness ratios. So I think, to me, the study is important, but the information's not complete yet.
Although perhaps not the final word on primary prevention with statins, the review does highlight some important questions that physicians should consider.
Who do we use primary prevention in is really the $64,000 question today in 2011. And what we have to turn to are the guidelines, the ATP3 guidelines, which will soon be revised to the ATP4. And we define our patients who, for primary prevention, who have risk, are those with what we call more than 2 coronary risk factors and an LDL cholesterol that's greater than 160. And then as we move from those categories, and you mentioned, for instance, the trial with rosuvastatin, the Jupiter study, this is another take on trying to find out who in fact is low risk and who is intermediate risk. Now, the recommendation from the guidelines is to use the Framingham risk score. I can't really predict what the ATP4 guidelines will say. I think in general they tend to be conservative, and I suspect that the revision will continue to focus on the fact that the more risk factors you have, the more benefit you derive from statin medications. So we may see subtle changes, but I still think we're going to focus on 2 risk factors and be more aggressive in primary prevention.
While questions remain about primary prevention use, one thing that is clear is statins' overwhelming benefit of secondary prevention for patients who've already had a cardiovascular event. I'm Crystal Fenn, MedPage Today.